I'm joined today with Carsten Schicker. He's the CEO of the World Health Summit. So the World Health Summit, Carsten, why don't we start by you maybe describing to our audience, what does the World Health Summit do and how does it fit into the larger global world health ecosystem?
The World Health Summit, which was actually founded in 2009. It started as a more or less academic conference. Scientists, researchers, mainly from Europe, came together and sought. And what they saw was basically a gap between the advancements we saw in medical research and science and what was actually happening all over the world. And they felt a strong responsibility to tackle that gap and to close that gap. So that was back in 2009. At that time, probably the term World Health Summit was a bit of hybris because it mainly brought together academics. That has changed quite significantly, and I think we are now the unique international platform for global health. What makes us unique is that we bring together stakeholders from politics, governments, science, the private sector, and civil society from all around the world. And what we want to do is we want to first set the agenda for a healthier future for all, and we want to catalyze and inspire innovative solutions for better health and well-being for all. That's what we do. So our main event is the World Health Summit each year in October in Berlin. We firmly believe that we can only achieve better health outcomes worldwide if all sectors really work together and start to learn from each other.
How do you measure success, not necessarily in terms of number of events or number of attendees, but in terms of impact?
There is a lot of things you can actually see that happen or that start at the World Health Summit. Just look at last year. In 2020, we hosted the largest event for the investment round for the World Health Organization, where $1 billion US dollars were pledged from member states and other institutions, philanthropies, for example, or even private sector players for the investment round of WHO. That was the largest event and the largest pledges WHO received so far, which was quite important for them also for their transformation journey they're going through. We have seen other pledging events. We have seen big announcements. We have seen the announcement to eradicate polio, for example, that happened at the World Health Summit. So these are obviously the highlight events, and you can in a way attribute the impact these events are having on the World Health Summit. But actually, I think what is even more important are the things that do not happen in the limelight of the big stage. We bring together 4,000 leaders from global health worldwide from all sectors. And what they do most of the time is actually network and sit together, discuss in smaller rounds, even starting from bilaterals to slightly larger rounds, creating trust, building trust among each other, really discussing the topics at hand and coming up with better solutions, new ideas. That's the impact we are also having. Obviously, that is harder to measure, but when we talk to our partners, to our attendees, this is the message we get very clearly. This is what the World Health Summit is really for: fostering, building, strengthening this network of professionals around the world and bringing them around one table. And that's not possible usually at other events. If you look at other global health events that are big and international, the World Health Assembly, for example, comes to mind, which is the, so to say, the General Assembly of the World Health Organization. But this is a very member states run, politics driven event. Each year in Geneva, you see thousands of people going there. But all the other sectors, not the politicians, but the private sector, the civil society, they are basically bystanders. They do a lot of side events, but it's very rare that people sit around one table and have a very open discussion. This only really happens at the World Health Summit in Berlin. And this is, I think, the probably immeasurable impact we are creating. So what actually happens is in many ways that we see we can learn from each other. It's not that the global north needs to teach the global south how to do healthcare in a proper way. And if you look at our health systems, they are in one way or another all strained. It's not that we have the perfect example in any of the more developed countries that you can say this is the perfect blueprint how you do healthcare. We are very far from that. Actually, it's what I see is quite the contrary. We can actually learn a lot from resource constrained settings, how you can provide healthcare in a more efficient and more effective way, applying new technologies, for example. The one example that is often quoted is the one of Rwanda, which is a resource-constrained country, rather small country in East Africa. What they have done after the genocide, they looked very closely at what kind of resources do we actually have. And it's pretty clear it's only people. So the government then said, there are two things we really need to focus on. And that is first, healthcare, and then education. And that's what they do. And they really are innovators in many ways, and there's a lot we can learn from how things are done in Rwanda. And that's an experience I have when I travel around the world, that it's obviously always easier to build something from scratch than to change an existing system. But the openness and the trust in progress in new technology is often way more present and way more advanced in resource constrained settings than in our saturated Western societies. So I think there's a lot for us to learn from these countries in many areas. Not just the I would say the learning between countries. There's a lot again to learn across sectors. And I think we tend to look at healthcare mostly from a government's perspective. And it's obviously it's the government's job to make sure that healthcare is available for the people in a given country. But on the other hand, if you look at how healthcare is actually delivered, that is in many, many cases not always done by the government, but by private sector players. Doesn't have to be industry, but even a self-employed physician in a way is a private sector player. And I think we often should listen more to voices and lessons learned from the other sectors in order to create progress. And that's something we try to do, so that not only politicians talk with other politicians, but that they start to learn from private sector voices, from civil society, from philanthropies, and obviously from academics.
You mentioned the adoption of technology. We don't really have these for-profit brands that have risen and demonstrated that they're really the brands to back, the companies to back, to deliver to us the promise of best practice when it comes to all these big challenges. And so we're still relying on, and maybe incorrectly relying on, governments and nonprofit and foundations to solve these challenges.
I agree. What I'm a newcomer, still feel like a newcomer to the world of global health, and having spent most of my career in the corporate world, I find it stunning that there is so much skepticism around the good forces or the good ideas that can come from the private sector. Often they believe that only the government can fix that, only politicians know what's best for the patients. And I think that's wrong in many ways. It might be true if you think about public health, if you think about emergency response. I think there you need concerted government efforts. But I don't think that government could or should define every single aspect of how you need to run your operations in a way. Yes, we need regulation. We need to make sure that people have access to quality care and that you need licenses and all that. But I think you need to provide a regulatory framework, but then you can actually use the market forces in a good way and also in an equitable way. But there is still, if you talk to from governments, obviously, but also from civil society, there's a great reservation still that the private sector can have a good role in that, apart from obviously making profits. And I don't think that's something bad if you in the end also achieve good outcomes for patients. I mean, so in a way, it feels like the world is still very much, the global health world is still very much.
Thank you for joining us on Analyzing Healthcare. Stay informed and stay inspired. Don't forget to subscribe and visit scale-community.com to become a Scale Community member. Until next time, keep exploring the ideas that shape our healthcare systems.